Thank you so much to everyone for being here. My name is Jesse Miller. My pronouns are he, him, his. Um, I'm a postdoctoral fellow at UC Santa Barbara Department of English, and this is Healing Arts, Health Activism, Creative Practice, and the Medical Humanities. So this symposium is being hosted from the University of California, Santa Barbara. And before we begin, I would like to acknowledge the traditional custodians of this place and all land upon which the university is located, and to pay my respects to the Chumash elders, past, present, and future, for they hold the memories, the traditions, and the culture of this area, which has become a place of learning for people from all over the world. Okay. So a couple of months ago, I came across an article from the South China Morning Post titled, "What is Bibliotherapy, and can it help maintain mental health during the coronavirus crisis?" This article begins with Hong Kong's self-imposed lockdown. Many people find themselves bombarded with news and information. But mental health experts suggest books can help alleviate the stress. The article consists of an interview with a purported mental health expert, a resident bibliotherapist at Ultimate Library's Barefoot Bookshop of Soneva Fushi, which is a luxury resort in the Maldives. This bibliotherapist explains the logic behind her bibliotherapeutic practice. She says, reading can be used as an escape during challenging or upsetting times, but it can also make you feel less lonely or shed light on your situation. Reading is one of the best ways of developing empathy and of feeling understood. My advice is follow your instinct and read books that will either help you to contextualize how you feel, relieve the mental pressure of what you're experiencing, or help you understand and process what you're going through. I was struck by the article because, on the one hand, what it says about the role that the arts can play in fostering well-being, especially right now, given the coronavirus pandemic. But I was also struck by it because of a limitation it highlights about the way that the relationship between the arts and healing is often discussed. So on the one hand, this kind of bibliotherapy practice acknowledges the pervasiveness of psychological distress and the need for care. And it also foregrounds forms of engaging with art that are often dismissed, ignored as unrigorous, unintelligent, and often excessively feminine. So these are some of the benefits of this way of thinking. But on the other hand, the article brackets out the larger context in which these needs for care arise. We might ask ourselves, who has access to this hotel and the luxury services that it offers at $1,500 a night? Why does such a place exist? How is it itself embedded in a system of global capitalism that makes possible global pandemics, but is unable or unwilling to care for those who are made most vulnerable by it? This same dynamic that we see in the article of both recognizing the need for new forms of care that art might serve as a useful tool for, but insufficiently accounting for the conditions that give rise to that need, I think also plays out in the field of medical humanities in many of the considerations of the role the arts can play within medical institutions. So the medical humanities, for those of you who aren't familiar with the term, is an interdisciplinary field that looks at health from multiple different humanities perspectives. So sociology, anthropology, philosophy, literary studies, media studies, um, and bringing these fields to bear for what they can help us understand about the social, cultural, and aesthetic dimensions of health and illness. And this field is not just interested in importing the content of medicine into the humanities, but also in exporting the tools of the humanities into medicine. So two examples of this sort of exporting of the tool of the humanities into medicine. One is called narrative medicine, and it's an approach that seeks to help physicians develop what's sometimes called narrative competency. So the idea in narrative medicine is that physicians and medical students are encouraged to analyze works of literature or film or graphic novels as a way of understanding how illness is not just a kind of narrow biomedical phenomenon, but actually part of larger life stories. And it's a way of thinking about the medical encounter itself in narrative terms. So this is one way that the humanities export some of their tools and ideas and objects into medicine. Another is arts in healthcare, in which patients in hospitals and other caring spaces are engaged in art making for many of the same kinds of reasons that were mentioned in the article that I drew attention to at the beginning. So things like escape and self-reflection and pleasure. And all of these practices, these uses of the humanities in healthcare spaces, are designed to humanize the patient experience. But the problem, like the problem that we saw with that bibliotherapy article, is that these approaches often fail to adequately address the question of why such humanization is needed in the first place. But I think there's another approach to thinking about this intersection of arts and healing. And this comes from artists who draw inspiration from disability justice and other social justice movements. So disability justice, just to give a quick gloss of the term, is a framework and a social justice movement that is led by disabled activists, including people like Patty Byrne. And it's a framework that examines the structures through which certain kinds of embodiment and enmindment are made meaningful and placed within hierarchies of value, so that some kinds of minds and some kinds of bodies are seen as more valuable than others. And it's a movement that works towards changing the world to eliminate these hierarchies. And I think this is a really valuable framework for rethinking the relationship between the arts and health. So rather than just thinking about the arts as tools for healing within a narrowly therapeutic or individualistic perspective, in putting together this symposium, I wondered if engaging with the arts can contribute to individual well-being, how can the arts also serve to re-examine what wellness means? Or how can the arts reimagine and enact new forms of care? Now, before jumping in, just a few thank yous to make. So this event is being hosted from the University of California, Santa Barbara. And so I'd like to thank the co-sponsors of this event. That's the Humanities and Fine Arts Division Office of the Dean, the Interdisciplinary Humanities Center, the Graduate Center for Literary Research, the Department of English, the Literature and Mind Research Center, and the Multicultural Center. Their financial support has made it possible to make this event freely available to all of you. I'd also like to thank UCSB graduate students Stephanie Goldstein, Shanna Colleen, and Marcel Strobel, who have been helping me in the planning of this event. And finally, I would like to acknowledge the graduate students, adjunct instructors, student workers, and so-called essential workers here at UCSB, without whom this university and in fact, all universities wouldn't be able to function. They lack the compensation, the support, and security that their importance to the university warrants. And the coronavirus pandemic has only made their work more essential and yet their lives more precarious. Their struggle and their activism should remind us that intellectual and creative work can be forms of care, and that this work requires care, not just rhetorically, but materially and institutionally as their condition of possibility.